All right. Thank you, everyone. We're going to give everyone a second to join us. Thank you. Welcome to another Brandon's briefing about COVID-19, everyone. Today, we're going to have a very, very special guest with us. We're going to make sure that we are able to hear from her directly in just 1 second, and then we will get started. Just give everyone a second to join us. All right. Thank you, everybody. Uh, Another 40 seconds and we will get started. We're going to give everyone another 40 seconds before we get started with Dr. Gourdine, who's been doing some great work around COVID-19. So we want to, as always, keep you guys informed by making sure that you're hearing from people who are the experts and right on the ground on the front lines of doing the great work around COVID-19. So thank you, ma'am, for joining us today. We greatly appreciate it. We greatly appreciate it. So,
Glad to be
just
here.
thank you. Just a few more seconds. All right, everyone. Welcome to Brandon's briefing. This is Tuesday, May the 5th, 2020. Today, I'm being joined by Dr. Michelle Gourdine, Interim Chief Medical Officer and Senior Vice President of Population Health and Primary Care for the University of Maryland Medical System. We're going to get to Dr. Gourdine in just 1 second, but as always, we want to start with giving you guys the latest COVID numbers for the state of Maryland and the city of Baltimore in particular. We are now up to 27,117 cases of COVID-19 in the state of Maryland, with a total death count statewide of 1,290. In Baltimore City, we have a confirmed count of 2,609, with 125 deaths in the city of Baltimore. 21215 is still the zip code with the highest with 415. 21218 is the zip code in the city with the second highest at 202. Remember, you can always get the latest information at coronavirus.maryland.gov or coronavirus.baltimorecity.gov. Make sure that you're always paying attention to that information and go there so you can see what's going on. I want to transition into our conversation now with Dr. Michelle Gourdine. We will bring in Dr. Gourdine on, as always, trying to give you guys the experts to hear from. So, Dr. Gourdine, first and foremost, just give yourself a brief introduction to everyone and what you've been doing and the great work that you've been doing in this COVID-19 crisis.
Sure. My name is Dr. Michelle Gourdine. I'm at the University of Maryland Medical System, where I'm serving as Senior Vice President for Population Health and Primary Care and Interim Chief Medical Officer, which means that I work with a team to coordinate the efforts across 13 of our hospitals. We have 13 hospitals in the medical system to deliver health care to the citizens of the state of Maryland. So obviously, we're very involved in COVID-19. And seeing people who present to our emergency rooms or need care in our hospitals, and also out in our outpatient settings as well, taking care of individuals with COVID. The other thing we think is really important that we're also engaging in is making sure that we're providing education, telling people what COVID is, what it means to them, and what they need to do about it. And that's why I'm so grateful to be able to talk to you today to get the word out about that.
Thank you. Thank you, Dr. Gourdine, and thank you for everything. Let's talk about the importance of social or physical distancing. What is your perspective and how do you encourage people to continue practicing, especially as people are starting to leave their homes due to the nicer weather that we had before today, at least over the past few days?
So I'm glad you asked that question. Social distancing probably should be called physical distancing because that's what we're really talking about doing. We don't want people to socially disconnect. We need to continue to stay in touch with each other. But the reason that physical distancing is so important is that COVID, as we know, is a very serious disease. It can cause serious illness. It can cause death, as you just stated in those statistics that you named. It's a respiratory disease, which means that the virus infects your lungs and it causes you to have difficulty breathing, and in severe cases you can die. So the way that it is transmitted is from close contact, person to person. So if you imagine standing close to someone and they cough, respiratory droplets might spray onto you, which could cause you to become infected by the virus. We understand that when somebody coughs, your respiratory droplets can travel up to 6 feet in distance. And so That is the reason that we want people to stay at least 6 feet apart. That is why we're asking people to socially distance themselves so that they do not place themselves in harm's way of catching coronavirus by being too close to an individual. What that also means is that you need to avoid being in crowded settings, because crowded settings obviously force you to stand closer together and make you more susceptible to inhaling respiratory droplets that might be infected. That's why we talk about the importance of wearing a mask when you're out in public. And here's something else I want to point out too. People may think, well, you know, I can probably tell if somebody has COVID or not. That's not necessarily true, because some people have the virus, they're infected by the virus. They may not feel sick at all, they may not look sick at all, but by your being in close proximity with them, you have the possibility of being infected by that virus, which could affect you or your loved ones very, very differently. So I know it's tempting, especially when the weather is warm, to want to go out, to want to hang out, to get out of the house. We've all got cabin fever. But I think it's so important for us to continue to adhere to wearing those masks or some type of face covering every time you're out in public, and to make sure you remain at least 6 feet apart.
Yeah, thank you, man. I want like you spoke about the good weather, and we're moving closer to summer. And for communities in Baltimore in particular, like the African American community, what that typically means, right? Mother's Day is coming up. Folks like to have cookouts and stuff. Let's talk about that. Some things, some questions like, can people and should people be inviting a few people over for a cookout? If so, how many? Should those people bring their own food utensils, paper plates, etc.? Even though we know sometimes we do that just culturally, but what should people be doing if for these kind of events that are just like a fabric of the culture of our community?
That's a really, really good question. And cookouts are definitely something that are very popular in my household as well. Right now is not a good time to be having a cookout, because we know two things about COVID. The closer you are to an individual and the more time that you spend in close proximity to an individual, the more likely you are to place yourself at risk for getting infected. So if you think about a cookout where you've got people gathering at your home, you're going to have people who are close together. One of the recommendations that the CDC, the Centers for Disease Control, puts out is that we need to avoid mingling with individuals from separate households for the time being. And that has to do with those individuals, you're not knowing who they may have been exposed to. So the recommendations right now are only mingle with those individuals who are within your household. You don't have to wear a mask if you live in a household with somebody each and every day. But clearly, you want to avoid mingling with individuals from other households, which means right now, unfortunately, a cookout is not recommended at this time. Um, Again, wearing those masks, remaining 6 feet apart if you're, for instance, out in public. Let's say you want to, instead of having a cookout, you want to go for a walk or you want to go to a park. That's fine, but you got to wear your mask and you need to stay 6 feet apart from other individuals. And I would recommend that that is the better way for you to get out and to mingle at this time, rather than hosting a cookout at your home or attending a cookout in someone else's home. Right now, it's just not safe enough to do that because we're not quite out of the woods with coronavirus yet.
To that point too, for people that are out in the park, they should still be wearing masks, but also what's a good gauge for them of what 6 feet is? Is it a car length, 2 car length, something for people to know how far separate they should be from their friends or loved ones or just other people who are out?
So here's how I think about it. 6 feet apart is, if you would imagine a sofa with three sections in it, that one sofa is roughly about 6 feet long. Another way to think about it is a shopping cart. You put two shopping carts together, that's about 6 feet. So good way to gauge how close or how far away you are from someone else, the sofa or two shopping carts put together.
Thank you. So you heard it from the dot. Think about your couch, and then think about two shopping carts from your local store. What would you say, Doc? Because we've heard a lot of this. I know I've spent a lot of time on these live updates, answering questions and trying to play down some of these misconceptions and myths. what would you say are the biggest ones that continue to be spread about COVID-19, and what can we do to talk about how we can rectify the false information to keep people safe?
So one of the myths that I heard early on, and I'm hoping that it's not still a myth now, but I'm just going to put it out there, is I've heard even among friends of mine, African American friends, initially saying that African Americans can't get COVID. I hope everybody understands now that is absolutely not true. In fact, if you look at our cities, including here in the state of Maryland, Detroit, Chicago, not only are you seeing African Americans get COVID, but in many cases, you're seeing them have greater complications from COVID and in some cases dying from that disease. So let me just put it out there right now. African Americans can get COVID and it can be very, very serious, especially if you have an underlying condition already like high blood pressure or diabetes. So that's one myth that I want to put out there. The other myth I've heard is that, COVID will go away once the weather gets warm. Well, think about it. We saw outbreaks of COVID in places in Florida, in New Orleans, other cities where there has been warm weather, and we still see COVID spreading from person to person. So, and furthermore, when you look at the weather that is warming, although it's getting cooler again now in the Baltimore area, but in weather that is warming in our state, what you're seeing is not a sort of decrease in the level of infection of COVID. So do not rest on thinking that when the weather gets warm that COVID will go away, because we just do not know that that's the case, and there is some evidence to prove that it is not. So what this means is, back to something I said earlier, we're not out of the woods yet as far as COVID is concerned. And here's one way to think about what we all need to do with regard to COVID. We actually have the ability ourselves to be able to take an action that not only protects our own health, but protects the health and the lives of our family, our loved ones, our friends, our communities, our seniors. You know, Being able to take that small step of adhering to the physical distancing, of wearing the mask, and the third thing that I didn't mention before, washing your hands, is extremely important. Sounds simple, but hand washing and washing your hands for 20 seconds is so important. The way I do it is to sing happy birthday twice. The regular happy birthday, not the Stevie Wonder happy birthday, because my husband asked me that one time. I said it's a regular version, but sing that twice, and that's 20 seconds. And what that actually does is the soap itself has an ability to break down the outer envelope of the virus and actually cause the virus to dry up. And so that is why it's so important to wash your hands and to keep them out of your face and keep them out of your eyes. So I know I put a whole lot into all of that, but I want to share that these misconceptions need to be countered by real information. And that information is that Black people can't get coronavirus. That information is that coronavirus is probably still going to be around in the warm weather, and that we need to continue to take the actions and the steps to protect ourselves and our families.
Thank you, Dr. Greene. I was going to ask you if we were doing the Stevie Wonder or the Baltimore Club version. So I'm glad you were able to clear that up to make sure. Dr. Gourdine, I know you have a heart out, but wanted to see if you wanted to take one more question before you left, because I think it's something that's very, very critical. And you
Happy
hinted
to.
at it just now, right? I think it's also about making sure, how do we implore people who are need to seek medical attention, COVID related or not, to do that, because people are afraid to do that, and when should they do that? But then also, before we let you go, are we prepared for potential surge or resurge of COVID cases in a few months, and what do we need to do to prepare for that?
Sure, sure. So let me take the first question first, and I'm glad you asked this. One of the things we are noticing in our emergency rooms is we are noticing obviously an increase in the number of people who are concerned they have COVID, but we're seeing a decrease in the number of people who are coming in, for example, saying that they have chest pain. And statistics would tell us that those people haven't gone away. And what we're concerned about is that people are worried about coming into the emergency room because of the presence of COVID. So I want to say a few things and be really clear about that. If you are having an emergency situation, we encourage you to come to the emergency room. At the University of Maryland Medical System, our emergency rooms are all open 24/7. We take care of COVID patients. we take care of non-COVID patients, and we take extra steps to separate the COVID patients from the non-COVID patients. So you will be safe. And if you are having an emergency health situation, we want you to come into the emergency room. The other thing I want to point out is this. We actually have the capability of being able to provide healthcare services via telehealth. So in the same way that we're talking using electronics, we can have our physicians to evaluate patients who don't have emergencies. Let's say you got a routine appointment you need to keep, you have a medication you need to refill. We have telehealth capabilities to be able to do that so that you don't even have to leave your own home. And so in terms of non-emergency situations, that's a great opportunity to be able to do so. Let me also, before I get to your second question, I want to share the 24/7 nurse hotline that we have, because we want to make sure that people are aware that they can call this number, and it's 1-888-713-0711. That is our 24/7 nurse hotline. If people have questions, if they are concerned at all, they can call that hotline. It is staffed 24/7 to be able to provide information to people. The last question you asked about is, are we prepared for another surge? That is something that we are doing every single day, is making sure that we're prepared, making sure that we're keeping our healthcare workers safe, making sure we have sufficient supplies, and making sure we have sufficient space in our hospitals to be able to take on a surge of patients. One of the things that our CEO instructed us to do early on in COVID was to be able to double the capacity of beds in each of our hospitals in the event that we had a surge of COVID patients. So what I can say right now is that we are working very hard. We have doubled that capacity, and we are preparing each and every day and monitoring trends, making sure we've got appropriate resources to be able to take care of any surge that comes our way because of COVID.
Thank you, and thank you, Dr. Gourdine. Thank you for spending some time with us this afternoon. Thank you, and for everyone who was listening, I'm going to read that number again. That's 1-888-713-0711. That's 1-888-713-0711 for that 24-hour nurse hotline. Dr. Gourdine, thank you. I hope the most important question I can ask you is that you and your family are healthy and safe during this crisis. Thank you for your time. We know that you have to duck out, but thank you so much for joining us today.
Thank you so much for having me, and thank you for everything you're doing for the citizens of Baltimore.
Thank you so much. Thank you, Dr. Gourdine. We will now let the doctor go and go to questions directly from the audience, the watching audience. So give us a second here as we transition, and then we will make sure that we are going the right way here. All right, let's see. We have a couple questions here. Ask a question. Should we be working with a patient if you have diabetes? Okay. I think that whoever asked this question, could you send a direct message to us so that we can make sure that we are giving you the best medical guidance that we can give you based on where you're working, who you're working with, all of those kind of things. And then I know my good brother Kenji had a question, says is why we need an outreach plan for the city. When will COVID-19 outreach at this street level be a priority? Kenji, as you know, this is something that I'm pressuring the administration on. I actually sent a letter to the administration specifically that I can share with you about outreach, and they talked to us a little bit about it in our council hearing last week, and we're going to continue to press them to do that because we know, especially in the 21215 and 21218 zip codes, that we need to not be waiting for people, but finding individuals and educating them about what's going on, because we can see the numbers, as the numbers I read off, are more drastic there than anywhere else in the city. Is there any other questions today? I want to thank everyone. We're going to be sure to re-air this with Dr. Gourdine so that we can continuously having people to see it and monitor it. I think she provided some great insight for us from a doctor, a trusted physician, a trusted person, an African-American woman who, again, can be able to explain to us across communities, but in particular in Baltimore's Black community, why we must take COVID-19 serious because it is impacting our community more than anywhere else. And we know why that is. Consistently, we will do that. And listen, my point blank real advice for everyone in Baltimore City is to take COVID-19 seriously. I know, like I said earlier, that Mother's Day is coming up. Everyone wants to get together with their families, but you cannot do that in mass groups. If you want to, if you truly love your friends, your family, you will do what's right and practice physical distancing, staying away from people who are not living in your household, making sure that you're following the guidelines and making sure that when you see businesses and people that are not doing it, that you let people know, because we cannot and we will not beat COVID-19 unless we are following and practicing the advice of not me, but the public health professionals like Dr. Gourdine and others who continue to tell us. We know that there are people doing crazy, idiotic things like opening up beaches, saying that we should go back to doing this, demanding that everything be open up. The only people's opinion that should be valued deeply right now when making a decision about whether it's in the best interest of your health or not are public health professionals, and they are saying no. So thank you everyone for joining us today. We will see you next time on a Brandon's Briefing. Peace, everyone, and stay safe.